Right now, somewhere in the world, an older adult is walking into the bathroom and noticing something unusual in the toilet. Maybe the stool looks darker than normal. Maybe it's strangely thin, almost like a pencil. Maybe there's a color that shouldn't be there. Most people look at it for a second, shrug, flush the toilet, and move on with their day. But what if that small change is not random at all? What if your body is trying to send you a warning sign, one that could reveal a serious disease including cancer? For seniors especially, the appearance of stool can reveal critical information about what is happening inside the digestive system. And the truth is, certain types of stool changes can sometimes be one of the earliest warning signs of colon cancer or other serious intestinal diseases. The problem is that many people ignore these signs because they feel embarrassed talking about them, or they assume it's just something they ate. But today, we are going to talk openly and honestly about something that could literally save a life. Because if you are over 60, or you care about someone who is, understanding what your stool is telling you might be one of the most important health habits you ever develop. Our digestive system is incredibly complex. Every day, food travels through the stomach, the small intestine, and finally the large intestine, also known as the colon. During this journey, nutrients are absorbed, water is removed, and the remaining waste becomes stool. Under normal conditions, stool should be medium brown, soft but formed, and easy to pass. But when something is wrong inside the colon, the appearance of stool often changes. These changes can be caused by many things, including infections, medications, dietary shifts, or temporary digestive upset. However, when stool changes are persistent, unusual, or combined with other symptoms, they can sometimes signal something much more serious. One of the most concerning stool appearances doctors watch for is very dark, almost black stool. This type of stool is sometimes described as tar-like, sticky, and extremely dark. While certain foods like black licorice or iron supplements can temporarily darken stool, true black stool can sometimes indicate bleeding somewhere in the upper digestive tract. As blood travels through the intestines, it becomes digested and turns the stool dark and tarry. In some cases, this bleeding may come from ulcers or stomach issues, but in other situations it can be associated with cancers within the digestive system. This is why doctors always recommend paying attention to stool that repeatedly appears black and sticky, especially if it is accompanied by fatigue, dizziness, or weakness. Another stool appearance that raises concern among medical professionals is stool that contains visible red blood. Some people notice bright red streaks on the stool or on the toilet paper. Others may see blood mixed into the stool itself. While hemorrhoids are a common and relatively harmless cause of small amounts of bright red blood, it is extremely important not to assume this automatically. Colon cancer and other serious intestinal diseases can also cause bleeding. The key difference is that hemorrhoid bleeding is usually mild and occasional, whereas bleeding related to more serious conditions can become frequent, unexplained, or mixed within the stool. Then there is a stool change that many people overlook because it doesn't seem dramatic at first. This is the sudden appearance of very thin stool, sometimes described as pencil thin or ribbon-like. When stool becomes unusually narrow for a prolonged period of time, doctors sometimes worry that something inside the colon may be narrowing the passageway. A growing tumor can create this kind of narrowing, forcing stool to pass through a smaller opening. Now, it is very important to understand that thin stool does not automatically mean cancer. Temporary digestive changes, spasms, or diet shifts can also cause this. However, when this type of stool shape persists for weeks, especially in adults over 60, doctors often recommend further testing to rule out serious conditions. Color changes can also provide important clues. Healthy stool typically appears brown because of bile produced by the liver, but when stool appears pale, grey, or clay-colored for multiple days, it can signal a problem with bile flow or the liver. On the other hand, stool that appears unusually green may simply reflect rapid digestion or certain foods. But if unusual colors appear repeatedly without an obvious explanation, it is always wise to discuss it with a healthcare provider. Beyond color and shape, frequency and consistency matter as well. Chronic diarrhea that lasts for weeks is something doctors never ignore. Persistent diarrhea can occur when the colon is irritated or inflamed, and in some cases tumors can disrupt normal digestive function. Similarly, long-lasting constipation that suddenly appears later in life should always be evaluated. Many seniors experience occasional constipation due to medications, dehydration, or reduced activity. But when constipation becomes severe, persistent, or accompanied by abdominal pain, bloating, or weight loss, it should be taken seriously. One of the most overlooked warning signs related to stool is a sudden change in bowel habits that lasts longer than a few weeks. Maybe someone who has always had regular bowel movements suddenly begins alternating between constipation and diarrhea. Maybe the urge to go to the bathroom becomes more frequent, or perhaps someone feels like they still need to go even after finishing a bowel movement. These subtle changes may not seem alarming at first, but they can sometimes signal that something inside the colon is affecting normal bowel function. Another important clue can be mucus in the stool. Small amounts of mucus are sometimes normal because the intestines naturally produce mucus to lubricate waste. However, excessive mucus or mucus combined with blood can indicate inflammation or other digestive problems that should be investigated. Many seniors also report a symptom that is not visible in the stool itself but closely connected to it: unexplained fatigue. When slow internal bleeding occurs within the digestive tract, the body gradually loses small amounts of blood. Over time, this can lead to iron deficiency anemia. When anemia develops, people may feel unusually tired, weak, short of breath, or lightheaded. In many cases, the stool may appear darker than usual due to the digested blood. This is why doctors sometimes discover colon problems only after investigating unexplained anemia. Weight loss without trying is another warning sign that should never be ignored, especially in older adults. When cancer develops in the digestive system, it can alter the body's metabolism and appetite. People may feel full quickly, lose interest in food, or experience persistent digestive discomfort. Now, here is the key message that many people misunderstand. A single unusual stool does not mean cancer. Everyone experiences digestive changes occasionally. Something as simple as eating beets can turn stool reddish. Iron supplements can darken stool. Antibiotics can cause diarrhea. Stress can alter bowel movements. The human digestive system is sensitive and responsive to many factors. The real concern arises when changes persist. Doctors typically become concerned when unusual stool patterns last more than 2 or 3 weeks, especially in adults over 50 or 60. Persistence is the critical factor. When the body keeps sending the same signal repeatedly, it means something deeper may be happening. Fortunately, modern medicine has powerful tools to detect problems early. One of the most effective screening tools is colonoscopy. During this procedure, a doctor uses a small camera to examine the inside of the colon. Polyps, which are small growths that can sometimes develop into cancer, can often be removed during the same procedure. This means colonoscopy is not only a diagnostic tool but also a preventive one. Removing precancerous polyps dramatically reduces the risk of colon cancer. There are also less invasive screening options, such as stool-based tests that detect hidden blood or abnormal DNA markers in stool. These tests can sometimes identify early warning signs even before symptoms appear. Many health organizations recommend regular screening starting around age 45 or 50, depending on personal risk factors. Diet and lifestyle also play a powerful role in colon health. Diets high in processed meats, low fiber intake, smoking, excessive alcohol consumption, and physical inactivity have all been associated with increased colon cancer risk. On the other hand, diets rich in vegetables, fruits, whole grains, and fiber support healthy digestion and help maintain regular bowel movements. Hydration is another often overlooked factor. When the body lacks sufficient water, stool becomes harder and more difficult to pass, which can lead to constipation and straining. Chronic straining may contribute to hemorrhoids and other digestive discomforts. Regular physical activity supports bowel movement by stimulating intestinal contractions that move waste through the digestive tract. Even moderate exercise like walking can significantly improve digestive health. Another powerful protective factor is simply paying attention to your body. Many serious illnesses become dangerous only because they are discovered too late. The body often sends subtle signals months or even years before a disease becomes advanced. Stool changes are one of those signals. They are not always dramatic, and they may feel uncomfortable to discuss, but they can reveal valuable information. It is also important for seniors to understand that digestive symptoms should never be dismissed simply as getting older. Aging does change the body, but persistent digestive symptoms are not a normal part of aging. They deserve medical attention. If you ever notice stool that is consistently black, tarry, bloody, unusually thin, or accompanied by persistent abdominal pain, unexplained fatigue, or weight loss, it is important to speak with a healthcare professional. Most of the time, the cause will turn out to be something treatable and non-cancerous. But the only way to know for sure is proper evaluation. The encouraging news is that when colon cancer is detected early, treatment success rates are extremely high. In early stages, it is often completely curable. Unfortunately, many cases are discovered late simply because early symptoms were ignored or misunderstood. This is why awareness matters so much. Something as simple as paying attention to what appears in the toilet bowl could make the difference between early detection and late diagnosis. It may feel uncomfortable to talk about stool, but doctors discuss these topics every single day. For them, it is simply another part of understanding how the body works. So if you are a senior, or you care for aging parents or relatives, make digestive awareness part of your health routine, notice changes, pay attention to patterns, and never hesitate to ask a doctor when something doesn't seem right. To summarize everything we discussed today, certain stool changes such as persistent black stool, visible blood, pencil-thin stool, or long-lasting changes in bowel habits can sometimes signal serious digestive conditions including colon cancer. While these symptoms do not always mean cancer, they should never be ignored, especially in older adults. If you found this information valuable, make sure to subscribe to the channel, like this video, and let me know in the comments what health topic you would like to learn about next. Your awareness could help protect not only your own health, but also the health of someone you love.